Can you just? Oh, okay, never mind. I'll just wait to get the document.
It's uploading. It's saying. I'm
gonna log off and just watch it from YouTube.
Okay. Who's logging on?
Sadiqa.
Oh, okay. No problem. It's saying uploading. Hi everyone. Welcome to our rendition of our Taboo Let's Talk. Hi everyone. I'm Sophia from Muslim Sisters of Staten Island, and joining us today, our wonderful, lovely panel of wonderful women. We have Sister Hina Navid, that she's going to be our moderator today. And then we have Deirdre Sully, MPH, that's going to be giving us a nice talk. Ooh, we got Mary Beth coming on. Thank you, Mary Beth, for coming. Should be popping up soon. All right. So I'm just gonna do the opening introduction. You want to hear it?
No one ever sees me, I'm losing every battle. No one ever sees me, I'm losing every battle. No one ever sees me, I'm losing every battle.
Okay. So everyone's talking about, let's talk about period poverty. Does anybody know what period poverty is? Can you hear me?
Yes, I can hear you.
Oh, okay. I'm sorry. Let me remove this from here.
Also, I just sent you a message. I didn't.
Yeah, I saw that.
Okay.
All right. I think we have Mary Beth coming on now.
Can you hear me?
I can
Yes.
hear you.
Can hear you.
Oh, good.
And I can see you.
Okay, can you see
Can
me
you hear
also?
us now, Mary Beth?
Oh, great. Okay. I'm going to try just to get it through my laptop then, because I think I can, or is this okay?
Yeah, that's fine.
Okay, great.
I got the email, Sophia, so we're good.
Oh, awesome. Oh my goodness. I sent it like minutes ago. Okay. Hi, everyone. My name is Sophia, and I'm from Muslim Sisters of Staten Island. And once again, thank you so much for coming on to our wonderful event tonight. We have Deirdre Sully, Mary Beth, and Hina Navid on the talk today. And we're going to be talking about period poverty. So I guess you could take it away, Hina.
Great. Thank you. Thank you so much. It's so wonderful to be here today on this really, really important topic, the topic of period poverty. The fact that it is a taboo to say the word period is something that we should definitely, that barely scratches the surface. And I'm so excited. I'm going to read a brief intro about the wonderful, amazing panelists that we have with us today. But I'm just so excited to just get right into this conversation. The general format is going to be, I'll read over the intro and then turn it over, read over the bios for Ms. Deidre Sully and Mary Beth Terry. And then each of you will have about 2 minutes to just talk to us, to let us know your thoughts. And I will be writing down questions. I'll be monitoring the comments in the chat. And then after you both go through your intro, we'll turn it over to questions. I'm sure I'm going to have plenty of my own, but I'll also give time to the chat to make sure I'm monitoring that as well. So a little bit about me. My name is Hina Navid. I'm a registered nurse. I'm a DACA recipient. I graduated from CUNY School of Law earlier this year, and I recently took the bar exam and passed. Thank God. So that stress is over. That's exciting, exciting. So I am a registered nurse. So all things health, all things medical are super important to me. I've also worked with vulnerable population, children in foster care. During the pandemic, I was volunteering on the front lines as a medical reserve corps member, and so I really saw health disparities at an up close and personal level, as well as a general systematic level. And I'm very excited to be part of this discussion, to moderate this discussion, and to hear from such wonderful experts that we have. And so our panelists today, we have Miss Deidre Sully. She is the outreach coordinator at a New Life Global Ministries Red Wrap Initiative. She's an experienced, award-winning professional with over 15 years in the public health field. She has proven success in partnership building, community outreach, influencing public policy, and she offers expertise in research, program management, advocacy, and communication. Currently, Deidre manages Red Wrap, which is a community service initiative providing feminine hygiene products to displaced women and girls. She's also the director of New York City Smoke Free at Public Health Solutions, leading the program's mission to expand smoke-free protections for New York City. As the director, Deidre develops messaging, provides overall strategic direction for the program, and provides insight to executive staff regarding tobacco-related advocacy actions. So welcome, welcome. It's so wonderful to have you here. Our next panelist is Miss Mary Beth Terry. Dr. Terry is a professor of epidemiology. That's going to be a weird word to say. A difficult word, epidemiology. I got this. At Columbia School of Public Health. Dr. Terry's research focuses on breast cancer and other cancers and in understanding ways to reduce risk of cancer. She currently directs Columbia's Herbert Irving Comprehensive Cancer Center, Office of Community Outreach and Engagement. Joining us later in the program is going to be Dr. Iris Dory, who's a board-certified OBGYN, who's been in practice for over 25 years. She's the medical center of the director she's the medical director of the Center for Women's Health at Northwell Health since 2003. She serves all age groups from children all the way through the geriatric years. She delivers babies and performs gynecological surgeries as well as these patients. Sorry, I lost my place, as well as these patients in the office, and treats all of women's issues, including family planning, menstrual disorders, PCOS, infertility, perimenopausal, menopausal issues. And she also performs cancer screening and primary care. She's married to an OBGYN who she met at Mount Sinai Hospital, where she worked for 6 years before coming to Staten Island. And she's the proud mother of 2 children and a dog named Jack. So we will welcome her when she arrives here, but it's so wonderful to have both of you here today to discuss period poverty. And so I will turn it over to Deidre for your few minutes, and then from there we'll go to Miss Mary Beth.
Yes, thank you so much, Hina. It's very nice to meet you. Mary Beth, nice to see you again. We work with each other on the tobacco side. But today we are talking about period poverty. I believe this is the week that leads up to Menstrual Hygiene Day, which is tomorrow. So this conversation is so appropriate and timely today. So at this time, I'm going to be sharing with everyone about Red Wrap and what we do, and also like a small demonstration / workshop at the end. So just very quickly, you kind of covered a lot of it. Do we have the slides? If not, I can definitely go through it. We don't need them. I can talk. If we don't have them, it's fine. Okay, I don't think we have them. Okay, so as you said, my name is Deidre Sully. I'm the outreach coordinator or consultant for New Life Global Ministries, which is the umbrella organization that houses the Red Wrap Initiative or ministry. So it is a ministry / initiative within ALGM, New Life Global Ministries. And we partner with community-based organizations to host targeted events that help displaced and unsheltered women and girls. So it's a nice long way of saying those who are homeless. We also have started to move into working with just overall and generally underserved areas. So working with community groups and based organizations like Muslim Sisters of Staten Island. So we're expanding our outreach and our network of those groups that we work with to provide menstrual hygiene products and education. So what does that mean? So why are we doing it, right? So menstrual hygiene and menstrual health is a fundamental public health need. The products are, especially for those who are most vulnerable, those who are displaced or unsheltered. Ensuring access to feminine hygiene supplies for displaced women is fundamental to maintaining their menstrual health. The products are among the most needed, but the least donated, right? It's kind of like socks when we look up, things that shelters need. A lot of times when we're here in New York, right? So when it gets cold, everybody's like, oh, I'm going to donate coats. There's an abundance of coats, but the things that are most needed are simple things like toothbrushes, socks, toothpaste. And for women, that's menstrual hygiene products. The lack of regular access to clean menstrual products for displaced women can lead to unsanitary practices, causing infections and other significant health risks. And that is what we call that is a definite symptom of period poverty. It's real. Women shouldn't have to make a choice between being clean, hygienically clean, and eating for the night, so that's an issue. When there's a lack of access to these things, sanitary products, menstrual hygiene, education, toilets, water, running water, that's where we have issue of period poverty. It's basically the lack of resources and funding that creates a trickle down effect for everything else. So helping unsheltered women maintain menstrual health and hygiene, it does help to eliminate stress. This is May. We're also rounding out the end of mental health awareness month. And so, stress is a big part of mental health. And when we are stressed out, it can have long-term effects, because our bodies go into that fight or flight movement. And so when we are stressed out for prolonged periods of time, it starts to take a toll, and there's wear and tear on the immune system. And then everything else, all other things start to go out of whack, so there's already the stress of not necessarily having shelter, food. And then there's the stress of having to feel like you're unclean and unsanitary, like if you're walking around and there's, if you're bleeding, right? And we know free bleeding is a thing, but it's not necessarily a choice for those who don't have places to go. I always, see these things about free bleeding. And as a person who does menstrual hygiene giveaways and health awareness, I made a personal task to try things. So that's what we're going to go over. I've tried underwear, I've tried cups, and of course, like the staples, the pads, the thick, the thin, the tampons. So we'll go over. I'll share like my anecdotal experience. So yeah, the distribution of much needed supplies to displaced women, it gives them room to safely address and maintain menstrual health. And just to recap, like ALGM, we are rooted in community service. So that is that is what is behind. That's the foundation of why we do what we do. We're dedicated to providing high quality life enrichment products and benefits. And really, a lot of times, like, I don't necessarily hear all the time, community service is actually, it's valuable. It can't be matched in a lot of things. It provides innumerable value to volunteers as well as the recipients. It helps with things like depression. Like, you'll be surprised when you're, feeling a certain way, being in service of others. And I'm not necessarily like, servicing like as, just a job, but being in service of those who are less fortunate than yourself, it kind of puts things into perspective. So that's, another thing that's behind, it's charity, right? So, we should all be doing charity. So that's a foundation for ALGM and how we operate. And Red Wrap is just one of the many initiatives that ALGM houses and aims to fill gaps of existing services and doing in great work. So the other piece of why we do it, I said that the target population is unsheltered and displaced women, or, and largely underserved. And that's really, it started because, and especially in New York City, because that's how we started. We started with a few shelters in New York City, and then we started to branch out. And then everything, it hit the fan. We all just was like, we were just confined for a year, and it's just like, what's happening? So this is like, you know, our re-emerging party. But yeah, so we do this because, or we started because 90% of all homeless people in NYC are people of color. There are black and Latino. So a lot of the people that we do service, they do tend to be people of color, because, like I said, we try to fill in the gaps where we see areas where there's most need. 1 in 4 homeless women, there are 1 in 4 women are homeless, like nationally, and 90% of homeless families are headed by women. So we started in shelters, specifically that house women, and then we moved to families. And then the last event we did were actually a younger cohort of ladies. They were starting at age 18. So we've kind of run the gambit. Our first event was with a shelter that was 18 and up, but no children. Then the next shelter that we worked with was families. So there were actually men, women, and children. And so we had a very nice event there with like a sort of a sister circle with women and children talking about menstrual health and hygiene and the things that we can do to take care of our bodies. And then the final center was with younger mothers who were displaced and unsheltered. So that's basically how we function. Which is largely donations, you know, everything. It really, this is charity. And then we also function off of the charity and the goodwill of others. So we partner with centers, shelters, like Muslim Sisters of Staten Island, and we will host like a drive. We didn't do it for this one, but you know, part of what we also do is like what I'm doing today is like the workshops, and that's part of how we partner. But if we're doing the full gambit, we do like the donations, and then we have a time period where we do donations, and then we'll have the distribution event, and that's all coordinated with the center. And as I said, we've done several centers so far. 3 in New York. The first one was the Help USA, and we did 2 centers in one day. We had 2 teams kind of split. And then we also worked with Henry Street Settlement, and that was the family center. And then the last event we did was with the Druding Center in Philadelphia. So we are branching out. And now we're here today with Muslim Sisters of Staten Island. So it's pretty fun. And then we do the workshop. So that's where I'm going to kind of talk about things. So it was really interesting when we first started this, when I sat down with the first center and we kind of went through like what was needed. And she was saying like, well, can you talk about personal hygiene and the different products? And I remember sitting there like, really? Like we have to talk about those things? And she was like, yeah. And then I remember having a conversation with another sister. It might have been Sister Sophia. And it was like, you know, we really have to make sure that we are spreading education and providing education, because the truth is, you know, a lot of the times we don't talk about what we don't know. So this is why the education is really key, because a lot of times people don't ask questions. So I was like, sure, we'll do it. So today I'm going to go over very quickly the products. So I'm not going to do the ones like the top 3. We all know panty liners, tampons, and pads, right? But what I am going to go over are the newer kids on the block, which are the reusable products, minus the reusable pads. So I have 2 products that I want to show. And I really like these products because, like I said, I decided if I'm going to do this, I have to like be able to speak truth and say like, oh, well, this was my experience, and not just give out products without knowing kind of like, or having experience in how they work. And after doing that, I am, especially because we function in working with displaced and unsheltered women, reusable products. In the beginning, we kind of thought, well, we would rather have like the normal, the pads, the tampons, because that's really easy. The truth is, the reusable products, while they may be costly in the beginning, they more than pay for themselves in the long run, because they are reusable. And especially if you're a woman who is unsheltered, this is what I was talking about. Like when you deal with period poverty, it can lead to unsanitary practices. There are some women who have used socks, newspaper. The ink from the newspaper can give you an infection. And also if it was dirty, like we don't know where it was, if you're reusing things that you're not washing. So the first item I'm going to go over are the underwear, and they probably work better for a woman who has a little bit more stable shelter, because of course you do need to wash it. All reusable products, you do need to wash it. So it's still in the package because it's part of like donations. I'm not going to take it out. So we have this, but I do have one that I can't take out that's clean. So and I don't want to, kind of endorse any specific brand, but I will say the brands that I have personally tried have been Thinks and Cora. And so the prices, they do range between like $23 to about $30. So I think they've actually gone down. So we have here a pair of underwear, and it's very thick in the crotch area. And in that is where the blood is held, and it works. I'm sorry, I'm realizing like I'm not even in the camera. So this is where it is, and they're black. And I've noticed that most of the underwear, so like even this, it's like a dusty rose color, but the inside is usually black for mostly what I've seen, which is also helpful for the visual part of things. And it's very thick. And I tried it, and it works. And I will say they do come in different. So you do have to be very mindful of the volume of your flow and of your cycle. And also be mindful of like how you bleed on each day. So, some women, they may bleed heavier in the beginning. Well, everybody, you bleed heavier in the beginning and then you kind of taper off toward the end. So if you bleed really heavy, you may want to use the underwear in conjunction with something, or you may want to use organic if you have the capacity to use organic tampon or pad, just to kind of keep yourself kind of secure if it's your first time using it. But these worked pretty well. I'm a convert, really. I'm a convert. So I do advocate for period panties. They work really well. And I would say, just be mindful of your cycle and your volume as you're purchasing. And I also say that because as a program, as an initiative that does this work, I'm imploring people. So, you can definitely donate to Red Wrap, and we will take all products. In the beginning, again, like I said, we would give the pads, the tampons, because we didn't necessarily receive these things in the same capacity, the same magnitude that we did everything else, the same volume. So when we do events, if we're unable to give everyone, the same, then we can only stick to the pads, the panty liners, and the tampons. So we did get donations, which is always good because menstrual hygiene is a part of feminine hygiene. So deodorant, especially if we're talking about helping displaced and underserved women, deodorant, body wash, extra regular underwear. These are the things that are most needed. And so the donations are, very much appreciated. And for us, you can definitely visit us on ALGM. On newlifeglobal.org, and there's a GoFundMe, and we can purchase the products, or you can send them to the mailing address in the website. So the other piece that I wanted to talk about, also clean, are cups. So with the cup, and the cup is a little, I can see, because I will be honest, I was a little bit taken aback, how are you going to do that? But you absolutely can fit it. Our vaginas are made to be stretched, specifically if you are over a certain age. And they do come in different sizes. And so the thing is, it's really about how much volume they actually hold. So they do come in very smaller sizes for younger girls who are just starting out. And there's all these different things on YouTube to show you how to put it in. I prefer, I think they call it the U method. So you would close it and then fold it into a U. And it's silicone and it's very hard. So you have to, your fingers have to be strong, and then you insert. So now, ladies, I will say this is your body. So you have to be comfortable with inserting this into your body. And the fluids that are coming out of it are yours. So just make sure that you have wipes. So that's another thing that we put in bags for the women are wipes. You know, it's and every woman should have wipes in their bag, because this is what helps when you're not in your own personal bathroom, where you can quickly wash your hands at a sink that's, you know, maybe a couple of feet away. So be comfortable with the fluids coming out of your body, because they're gonna get on it's gonna get on your fingers. So and that's okay. You know, we're talking about periods being okay. This is your body. So what I learned, the cup, it actually holds for, I think, about 8 to 10 hours, and it's supposed to be good for at least and it depends on the brand, but anywhere between like 8 and 10 years. And the underwear, the manufacturer for this brand and the other brands that I've worn, they say about 2 years, because of course you have to wash it, and there will, of course will be some natural wear and tear. You do not use fabric softener, because fabric softener will slowly degrade the integrity of the material, and also it messes with the core that's inside that actually helps to absorb the fluid. So that's my take, my spiel on Red Wrap and what we do, and kind of like our move toward including reusable products for homeless women. Like I said, they are expensive in the front end, but they more than pay for themselves because of the way that they're able to be used. So we definitely advocate for reusable products, and they reduce carbon footprint. So that's Red Wrap in a nutshell. So we do these types of events. And so again, like I said, this is our reemergence. So if anyone is watching and you would like to partner with Red Wrap, such this way that Muslim Sisters of Staten Island did, you know, I encourage you to reach out to us. You can find us at www.anulifeglobal.org. And you can email us at redwrap@anulifeglobal.org, or you can email me at deidra@anulifeglobal.org. Thank you.
Great. Thank you so much. Oh my God, that was super informative. And just the whole time you were talking, I was like, wow, this is like every time I thought that you were going to be done saying what Anu Life was working on, you were like, and then one more thing, and then one more thing. And so I was like, oh my goodness, it's just so much, which is so amazing. I think hearing your experience with those that are housing insecure and working with them and navigating is so inspiring. I have done work in the immigrant rights community, specifically with undocumented immigrants, detained immigrants, and a lot of what you are highlighting as issues for those without stable housing are also issues for women and young girls who are incarcerated or detained, right? Because the same system that incarcerates also detains, and does not have the infrastructure to provide that sort of support. And so hygiene, privacy, these sort of basic things, access to feminine hygiene products are huge issues in those communities as well. And so it's just super exciting to hear all the work that Red Wrap is doing under Anu Global. It sounds amazing. And just for everyone else, it's ANU, Anu Global, because I know that when I was like trying to Google it, I was like, Anu, how do I spell this? So it's ANU Global. And Life Global, sorry, ANU Life Global. Yes, thank you, teacher. And so that was just super exciting. I also wanted to sort of highlight your feeling of shock of like, oh my God, we have to discuss this. Because so for me, when I was in undergrad, I was a peer educator at my college. And so what that meant was like I talked to people about reproductive health products, condom use, etc. And those initial conversations was like, well, doesn't everybody know what this is? Like, wow, like, you know, and sort of that like jarring experience of like, you know, especially in the Muslim community, we know that there's a taboo, right? I mean, in a lot of communities, but especially as someone who's a Muslim woman, like that is not something that you discuss with the women or with the sisters, or, you know, you hide your pads in like 20 rolls of toilet paper and shove them deep down in a trash can that's in the back of the cabinet, right?
Yes.
So you like don't really like talk about it. And God forbid a brother or a father or an uncle sees like a little red dot somewhere, it's the end of the world. So it really is groundbreaking to be having this discussion under, you know, with Muslim sisters and really all, you know, and all of us together discussing it so openly, so that, you know, of course, with the advent of Google and iPhones, it made it easier to Google things. But as we all know, you know, it's only as good as your search terms that you use. And so the opportunity that people have to engage around this, I think, is really, really exciting. And Deidra, you've been doing amazing, incredible work. So it was so wonderful to hear that. I will just quickly shout out Dr. Dory. I know you joined us. I gave your intro earlier. We were very excited to hear that you're a proud mom of 2 children and a dog named Jack. and so I just the format generally. I went over intros, and now each person is sort of has some time for their platform for their pitch, and then at the end I'll be monitoring the comments if there's any questions, and we'll just sort of have like an open discussion about challenges and where we go. So. Deidre just went over her amazing, incredible pitch, and now I will turn it over to Mary Beth, Dr. Terry.
Great. Thank you so much. And thank you for the invitation to speak. And Deirdre, that was amazing. And I learned so much too. I have to admit that I am old enough that my first menstrual product was shown to me by my mother, which involved using a belt. And it was very large and very different than what you showed. So thank you so much. And thank you for all of your work and leadership, Deirdre. I just in awe of all you do. I had the pleasure of interacting with Deirdre last summer on some of our anti-vaping campaigns. And my main job is really as an epidemiologist, as you mentioned. And now after COVID, I think everyone knows a little bit of what epidemiologists do, but primarily what I am is a cancer epidemiologist, which means we try to understand patterns of cancer around the world and in our communities. And specifically now on Staten Island, which I'm thrilled to be part of this forum, what we'll be working on in partnership with many different organizations on Staten Island is helping to get the word out on the HPV vaccine. So I'll speak just a minute about that if I can, and then talk a little bit about our research, what we're doing about menstrual health and also adolescent breast development, and trying to understand the drivers of that. But first, I'll tell you a little bit more about what we're starting now. We just started just May 1, but we'll be working over the next 3 years on trying to reduce cancer rates in Staten Island. And primarily, this is through New York State. And the 2 areas that they have our whole team working on. One is about skin cancer prevention, and the other is about HPV vaccination. And HPV vaccination is really a cancer vaccine, and that's a vaccine that that all boys and girls and adult women and men are eligible to receive. And around the world and in other countries, it's really called a cancer vaccine, but it's definitely like, the taboo we're talking about today with menstrual hygiene. People just don't talk about it enough because human papillomavirus is a sexually transmitted disease. And it can cause many different cancers, including cervical cancer, anal cancer, head and neck cancer. So these are cancers that are really hard to screen for. Cervical cancer, as many of you may know, there is a screen for, but it's much easier if you can get the vaccine, because the vaccine is super effective. And so we're talking a lot about vaccines now with respect to COVID, but the human papilloma vaccine is something, again, that you can get. Generally, they say to start thinking about that with your healthcare provider at about age 11. And of course, you can get it later if you want, but it's definitely a vaccine that can prevent a lot of cancers that can't be screened, that are fairly lethal cancers. So what I do also at Columbia is focus a lot on what is changing about girls' bodies and why, why are girls menstruating earlier? Why are their breasts developing earlier? And that's not unique to girls in New York City. It's actually seen all around the world now. So all around the world, girls are developing breasts at an earlier age, and they're menstruating at an earlier age. And so that has implications for a number of things. And the cancers that we study in particular, like breast cancer, having earlier breast development, is something that can increase your risk later of breast cancer. Fortunately, cancers are still fairly rare, but it is something that we're looking into. And specifically what we looking into is really trying to understand environmental chemicals and how they influence earlier breast development. Because again, the earlier breast development and earlier menstruation is not is not because of changes in body size solely, because many places around the world where you don't have a huge obesity epidemic, they still are developing breasts earlier. So we're very much interested in understanding the environmental chemicals that may be associated with that earlier breast development. And usually girls develop their breasts and then about 2 years later may start menstruating. But again, everybody is different. And so that's some of the work that we're doing now with trying to understand girls' periods. And so now there's a lot of different apps, and we work with one app that's called Clue. And if you're interested, that's something, if you may have already heard about that app, or you may have a favorite app. There's a number of different apps where you can use to kind of it helps predict when your next cycle might be, and that's a very useful thing too, just to know your own body and your own health, because for many years people said, oh well, the average period that girls get is 28 days long. Well, that's what then people say is the average, but there's a huge range. So it's always better to know your own body, and a good way of keeping track of that is really through an app if you're interested. Again, most of these apps are available. Many of them are free apps, and that's one way of understanding your body more and understanding the changes during your cycle. So I'm happy to answer any questions about the human papilloma virus vaccine, or about changes that have been seen in communities and all around the world. One of the things that is relevant to tonight's discussion too is a topic called the pink tax. So this is something that, again, only just recently through a lot of organizations and promotions and pushing policymakers to change, has only recently changed. So what is the pink tax? The pink tax is known now that women and girls pay more for certain products than men, which makes absolutely no sense. I mean, it's across the board in clothing. Even they've seen, toys that girls play with are more expensive than toys that boys play with. They estimate that women, for example, basically have a tax of over $1,000 per year, based on how consumer products are taxed. And of course, this is all the products, the menstrual health products, have the highest pink tax, if you will. But other beauty products and personal care products have a huge tax, which are much higher in women. Like, you can take an average razor, it'll be more expensive in a woman's product than a male product. So that's what's referred to as the pink tax. Fortunately, in New York State, and as many of you know, a lot of policies are at the state level and are not similar necessarily from state to state. That's true with how people find out about the human papilloma virus vaccine. In New York State, you can actually get a vaccination through the school system. Some states, they don't even have wide health campaigns about it. So it's very different about how you hear about these things. In New York State, they do have now, as of I think the last 4 years, in 2016, they actually banned the pink tax. So in New York State, they've done that, but in 30 other states, menstrual products are still charged that extra pink tax. So that's something that is definitely not a nationwide policy. It's a state by state policy. And so fortunately, in New York State, they've banned it now, but that's, again, only because of great organizations and all the work that that many people do in the community to push for better policy changes. So I'm happy to answer any questions after the next speaker, or in the chat box if you have any questions about the human papilloma vaccine, or about any of our cancer prevention work. If you want to email us, we have a summer program. It's Columbia Cancer COE at cumc.columbia.edu. So Columbia Cancer COE at cumc.columbia.edu. I'll also put that in the chat box. And if you're interested, we can send you information about our summer program. Again, through partnership with all the great leadership that Deirdre does on anti-vaping and anti-tobacco campaigns. We work together in the summer months for programs for high school and undergraduates. So thank you again for inviting me tonight. And again, happy to answer any questions.
Thank you so much for that. I mean, that was so incredible, and I think I'm going to age myself a little bit, but I was around when HPV vaccine first came out, Gardasil, and it was only available for women. And so I remember, like, my pediatrician. I had a private pediatrician who offered it to me. I actually was in Massachusetts, and you're right, the schools there in that state did not have public health systems the way that there's this partnership between Office of School Health and the Department of Education in New York City specifically, and even other parts of New York. I mean, within New York City, that partnership is not as robust as it could be. Um, and on the subject of pink tax, I mean, I definitely remember being a broke college student on a budget, trying to buy disposable razors. And before I knew there was a thing called pink tax, being like, why is this blue razor less expensive than this pink razor, which is exactly the same product from the same company, and being like, all right, I guess I'm just getting a men's razor today. And then yeah, when the terms around pink tax, when it became more mainstream, being like, oh, I've been experiencing this and sort of feeling this, all along, and sort of naming it, claiming it, and then overturning it, which is the goal, has been quite a shift from really buying products at a younger age. So thank you for all that you're sharing. And I, for some reason, my comments are not loading, so I'm going to defer to Sister Safia to just make sure that the comment section is working. But I can see our private chat, so that part is working. But I will turn it over to Dr. Dory, and then once Dr. Dory's done speaking, then we can just go over a few questions. But I'll turn it over now. Thank you so much. No, unfortunately, we can't hear you. It shows that you're on mute.
Oh, no. Now can you hear me?
Yes, you're with us.
Okay, great. Okay, hi. Thank you so much for including me in this very important conversation. I really feel, and I can't emphasize enough how important education is. And assuming that someone knows even the most basic fact, you really are depriving them of maybe a piece of information that they really, really need, and an assumption that they know the information is not fair because not everybody knows. And just as a personal anecdote, I'm an OBGYN and my husband is an OBGYN, and I have a daughter who's now 20, but when she was 12, I thought I had educated her and informed her on what to expect when it came to her menstrual period. And one day she called me into the bathroom and she said, "Mom, what's this?" And I said, "Oh, okay, that's your period. Congratulations." And she said, "Oh, I've been having this for 6 months." And I said, "What? 6 months? I failed you. I failed you as a mother and an OBGYN." And so you just cannot assume. And another anecdotal story is basically when I was a new mother, I delivered my first child at Mount Sinai Hospital, and I was a resident there at the time. And the nurses came in, and I guess because I was an OBGYN, they assumed I knew how to take care of a newborn. And I didn't know anything about taking care of a newborn. So I was desperate for education. So anyway, it's so, so important. So I am an OBGYN, and I'm the medical director of the Center for Women's Health, which is the women's center that's located directly across the street from Staten Island University Hospital. We care for the uninsured, underinsured, and insured patients, women on Staten Island, and we offer all sorts of services for women who do not have insurance. We participate in the planning.
Sorry, we lost your audio.
I'm sorry, I'm back. Can you hear me?
Yes,
Can you see
back,
me?
yeah.
I'm sorry.
Yeah.
We participate in the Family Planning Grant, which is a state-funded grant where women without insurance can come and get family planning resources such as birth control pills, IUDs, Nexplanons, injections. We also participate in a prenatal care assistance program for women who don't have health insurance. And we have sliding scale. So we really feel that we are taking care of all comers, and we're very proud of the care that we give. And in addition, just as a comment about the HPV vaccine, we are passionate about vaccinating the women of Staten Island. And we find that our vaccination rates have increased due to education, because we do provide a lot of educational material to the patients up front in explaining the benefits of the vaccine. And having that conversation either through a verbal discussion or through written material really improves the compliance rate with the vaccine. So that's something that we've been working very hard on. So I'm going to discuss something that a lot of you know, or I shouldn't assume that you know, but I'm going to talk about it because it is a very basic woman's issue, and we shouldn't be afraid to talk about it. It is a normal, healthy process, and I want people to feel comfortable. Back in the day, you couldn't even mention the word period on television. It was taboo. And, now as women, we should talk about it, share our experiences, and support each other, whether we're having a normal process or, even questioning whether it's normal. So I'm just going to go over some normals and what to expect, and then just things, available and open to any questions someone might have. So just some basic definitions. The normal age of onset of a menstrual cycle is anywhere from 9 to 15, give or take a year in either direction. The normal length of a period is anywhere from 2 to 7 days. The normal length of a menstrual cycle, meaning from one period to the next, is anywhere from 21 to 35 days. So not everybody has a 28-day cycle, as was mentioned earlier. And the normal amount of blood loss during a period is anywhere from 6 to 16 teaspoons. So I try to make it in terms of something people can understand. And anything more than 16 teaspoons or 80 milliliters is considered abnormal and excessive. Okay. Most young girls, when they first get their period, don't normally have what you classically think of as a normal period. They normally have what looks like brownish blood because it's not really a heavy flow. And so it can look brown, it can look black, and that's just from the blood sitting on your underwear or in your vagina, and then it doesn't come out quickly, so it's not bright red. At the beginning, most periods are irregular. They don't come regularly because the normal neurological system of a young girl is not completely developed, and so it's not going to be as regular as it would be for someone who's a little bit older. And young girls when they first get their period, they don't usually ovulate every month. And that happens later on. So this lack of ovulation is partially the reason that they're not getting their period regularly. And eventually, as they get a little bit older, their cycles become more regular and more predictable in most cases. Having a period really is nature's way of quote unquote cleaning the uterus. I don't really love the word cleaning. It implies that there's something dirty, and there's really nothing dirty about this. This is nature and natural and healthy and good. And I just want to emphasize that as a very important point. Um, so the way we count, because everyone talks about days, the first day of your period is the first day of your cycle. So from the beginning of your cycle is day one. And then at the end of your period, your uterine lining is as thinned out as it's going to be during the cycle. And through hormonal stimulation, the lining gets thicker. It's basically preparing for a fertilized egg. And in the case of fertilization taking place, the egg then implants in the thickened lining. But if there is no fertilization, as is the case in most menstrual cycles, then there's hormonal triggers that cause the shedding of the lining, and that is normal, and that is the menstrual period. Most women ovulate monthly, and it's later on. It's the ovulation and the hormonal release as a result of the ovulation that causes the regular, predictable cycle. But there are some women who don't. Women who have PCOS or who have other health issues, and PCOS is polycystic ovarian syndrome, for those of you who don't know, they may not be ovulating regularly, so they may skip a month or two or three. And that is something that needs to be discussed with a gynecologist or a family practitioner, or someone that they feel comfortable sharing that information with. So this continues on cycle after cycle after cycle, until a woman gets a little bit older and she starts to, she's done childbearing, she's in her mid 40s, and her ovulations become less regular again. And then at that point, her bleeding also becomes less regular. So the interval between periods can lengthen. And usually as that interval lengthens, we start working our way towards the menopause. And menopause is basically, by definition, when you haven't seen your period for a year or more. So during that perimenopausal period, women may, skip a period for 6 or 8 months. And then at the end of, 8 months, then they have a period. So they're not technically in menopause yet. But after it's been a full calendar year, seems kind of arbitrary, but that's what we use. A full calendar year is what we consider menopause, and everybody enters menopause differently. Some women bleed more, some women bleed less, but the ideal situation for most women is, the bleeding slowly spaces out and then eventually ceases, and that is normally what women see. And we at the Center for Women's Health, we deal with all sorts of issues in women's health. We see patients anywhere from the age of 10 all the way up until forever. I have women, not forever, but I have women in their 90s who come and they really don't need to come, but they really enjoy getting out and seeing a doctor or having a conversation. And it's my pleasure to do that because, those are my favorite patients. And we do a lot, and I feel we do a lot of good for the community. And, we are, very available. And, we have, we also see patients who have health insurance. I mean, we see all comers. And, again, education is a very important part of what we do. And I appreciate everything that you're doing. And if I can answer any questions about anything regarding gynecology, menstrual cycle, normal, abnormal, anything, I'm here and available.
Thank you. Thank you so much, Dr. Dory. I think one of the points that I really appreciated that you reiterated is education, because, this purpose of this whole event, we're coming together to talk about period poverty, but also really addressing the taboo of using the word period or discussing these things. And if you can't talk about it, you definitely can't learn about it, or the way that you're learning about it is it has gaps in it, or is stilted, or comes through 3 or 4 different messengers, and we all know how telephone went back in the day. And so it really spreads more misinformation. And so I think the fact that we're all here together is revolutionary, right? And there's still so many people who aren't comfortable having that conversation. And something Deidre mentioned earlier, being comfortable with your body, understanding that this is who you are, and being comfortable in it enough to be able to ask these questions, to have this conversation. Because every time you do that, we break a cycle, and we ensure that the next generation of young girls and women aren't entering this world mired in confusion, and instead it is a celebration. And so I think the anecdote you shared about you are talking to your daughter and saying congratulations, it's something so many young women didn't hear and don't hear. In many parts of the world, women and young girls are not allowed to go to school, allowed to go to religious houses of worship, allowed to even socialize with their friends when they are on their cycle. And it is actually very isolating, especially when we know the hormonal changes that come with our periods. And while it's something to celebrate, it's also something to really agonize over for many of us. And to then be isolated can really further that harm. So I'd love to hear more from you, Dr. Dory, about as part of your education, what do you counsel your patients or your families on when it comes to mental health, or the implications of that, their emotional well-being as it comes to discussing their periods?
So, that is something that, a lot of our patients seem to be very comfortable, or I guess we assume that they are somewhat comfortable with the menstrual process. We don't see a lot of 12, 13, 14-year-olds. Those young girls tend to go to the adolescent pediatricians. But we do a lot of education, mental health screening, not specifically about menstrual issues, although, we do talk about, PMDD, and we talk about, all sorts of things related to mood, like you said, hormonal changes that contribute to I don't want to say mood disorders, but, the mental changes that occur as a result of, being getting your period, premenstrual and during your period. I mean, we do have those conversations, but to be honest with you, a lot of that is being done by our colleagues in the adolescent clinic. But women who come in and say, what I see is the other end of it. I see a lot of the women who are going into, who are perimenopausal, who, can't, they're very snappy, and they have, they're very short with their family members and their partners, and they come to me for help. And those patients I counsel a lot on hormonal changes that occur as a result of approaching am I muted? Oh, sorry.
You actually went mute, but you're back.
I didn't do that. I didn't do that. As a result of, the hormonal changes on the other end of the spectrum. So that is something that I see, and I counsel them about hormonal supplementation, natural ways to increase their, their natural estrogens, and things that they can do to decompress, like yoga and meditation and exercise, those types of things, to help relieve some of the changes that they're going through as a result of the hormonal fluctuations. So I don't know. I hope I answered your question.
Yes, yes, no, absolutely. I mean, and and what you described is incredible, right? Because there are absolutely two ends of that spectrum, and to address it on both ends is so important. And when it comes to yoga and deep breathing and self care, I think those are practices we can all take, men and women, and in our lives. I know that I get a little cranky when I don't have my caffeine, so I could also use that advice. So thank you. I really, really appreciate that insight.
Yeah.
Mary, oh, sorry, go ahead. Talk to me.
Sorry. No. And I really appreciated what you said about, these women who are not allowed to be around other people during their periods for cultural reasons. I mean, I respect the cultural norms, and I have no issues with that. But I do feel that it's, a subject that we need to talk about. Like, using the people used to call their periods a nickname, like my friend or my, things. You can't even mention it. And that's just so shameful, because it is such a normal, wonderful process that we as women are so privileged to, be a part of, and it be part of us. And so, I'm so happy to talk on this, and to, to celebrate the period and women, and be a part of this group. So thank you so much.
Yes, thank you, of course. Mary Beth, are you still here? I know your video and audio off, so I don't know if you had to step away.
Oh, I am. Yes, I am still here. I was just listening. That was a great talk. So thank you.
Yes, perfect. Yes, so I did have a question for you as well. You mentioned the trends that that are being observed or analyzed as it relates to earlier development in young girls and young women, so earlier breast development, earlier onset of their periods. What are the implications of that long term, or and what are ways that we can support our young women and girls who are going through this process? So just, as an example, I know that one of the issues that women face at a higher rate than men is the rate of osteoporosis, and that's the result of calcium being pulled out of our bones as we are going through this this menstrual process and other processes. And so is the earlier onset of this breast development, of period, of the onset of the period, having those type of implications? Is it too soon to tell? And what can we do to sort of reinforce our bodies to be able to take on this strain, for a longer period than normal? No pun intended. Sorry, you're on mute.
Sorry, just to reiterate too what the other speaker spoke about too, like what we know more and more about, and this is why it's important to educate and have open discussions about this, is that when people say what's normal, what's abnormal, the reality is everyone's body is different, and we should actually talk about this, and we should demand more research be done on girls' health and women's health. It was only really just 30 years ago that one of the major studies of women's health just started, and that was because one of the heads of a major NIH NIH Institute was a woman. So, prior to that, a lot of what we knew about most diseases like heart disease were really from studies in men. So we do learn a lot uh, about health from people participating in research, and really also open dialogue and discussions, and realizing that there isn't one normal a way of for anyone, and that there's a range, and what we should think about is what's driving those earlier trends, right? That we should talk about it so people don't feel abnormal. The word normal and abnormal should never be applied to health. And so, we should learn more about, that these are things that are happening in many places and many girls, and it's not something that anybody does wrong. It's something we have to understand. What are the drivers of that, and why? Is it more stress in the environment? Is it because our diets have changed? Is it because environmental chemicals have changed? So that's what we need to do research on. But really, the more we can talk about it, and the more we can demand that research and health is also focused on women's reproductive events, like the initiation as well as the ending. We know so little about menopause too, and so that's also something that the more we learn about what is normal, and what we all go through, the better off we are.
Thank you for that. And absolutely, absolutely. I like your sort of categorizing or walking away from calling it abnormal or normal, and really just identifying it as experiences that we're all feeling. I do have one question in the comments, and this could go to either of you, but I think it might be to Dr. Dory. Sometimes women or young girls don't know that they are supposed to experience a shift in emotions. What is some advice that can be given?
Well, I mean, I don't know that all women experience a shift of emotions. I think that it is a very individualized process. And I agree, the terms normal and abnormal should not really be used when it comes to these things. I think supporting a young woman, and assessing, basically, is she able to, is she incapacitated with the mood changes that are occurring as a result of the hormonal changes, or is she just a little overwhelmed or a little anxious or a little sad? But yet still able to go to school and do her homework and talk to her friends on the phone during that time. And those are sort of things that we can gauge as, is this something that's incapacitating for her, or is it something that's just quote unquote normal or regular for her? But basically explaining that their mood shifts are a normal process for some people, and that you may have it this month, but you might not have it next month, and it's just it's a learning curve, and so assessing how incapacitating it is or not is something that we can do with our patients, and then supporting them, and giving them tools to handle it. There are things you can do, there are medical things you can do, and then there are other non-medical, non-medicinal things that you could do, like we discussed, like exercise, and finding an outlet for some of those even hormonal affected moods can be benefited with things like exercise and yoga and meditation. So giving them the tools to do those things will help.
Yeah, absolutely. I love that. I think emphasizing the listening to your body, and honoring it and learning about it, while having the tools to address that as we move forward, to really empower our young girls and our women. So I absolutely love that. Thank you. So I don't have any more questions in the chat. Oh, sorry, I do have one more question. I'm sorry. What advice do we have for men, husbands, etc., partners, to help support their partner during their period? And I'm going to limit this to top three, because I feel like if someone asks me this question, I have at least 3,500 things I can say. So we will limit it to top three pieces of advice from each of you that we can give men, husbands, partners to support their partner who is going through their period?
Okay, so I would say first, I always have an interesting dynamic when the partner is in the room, because I am so pro woman. um, and they're always outnumbered because it's 2 to 1. But I mean, I basically say, this is not always something that is controllable. And, just be patient. This is not, this is, and in most cases, it's just a matter of being a little short tempered or a little bit, the woman is a little short tempered with her partner. And I just say, this is all normal. And just as a couple, you need to communicate and talk about it, and just be a little bit more patient, and maybe, like, not snap back, or try to control yourself. And be a little bit understanding. Men have their own hormonal swings, and we as women, we see it for those of us that are in relationships with men. We see that too. So it goes both ways. Women need to be patient with their partners, and their partners need to be patient with them.
So it sounds like your top three are: have patience,
patience,
communicate,
patience. Yes,
patience,
patience, communication,
communicate, and have restraint. So
restraint, and support.
restraint and support. Okay.
Always support your partner.
Okay. Love it. Mary Beth?
Sure. I guess having gone through menopause and saying, if more men went through menopause, we would have had time off for menopause, because I had some really difficult time and years, and it lasted a long time. And it's very hard on sleep, but that was me. Not everyone goes through it like that. So I would say my number one, my number two, and number three are all about listening. So first and foremost, listen to your own body. Everybody's different. And so you listen and know, when, things may be harder during certain parts of the month, or certain years of your life, and then try to get as much sleep, because sleep is so important to health, as you can, and listen to your body. Number two, listen to the people around you. I think one thing that often is associated very much with menstrual periods is mood swings. And as Dr. Dory just so astutely said, men have plenty of mood swings too. And I have, after working in the workplace for 30 years now, and having so many people react very emotionally who are men in meetings, but that's not that's not attributed to their time of the month. Whereas if I was to react in a similar way, it often was. Again, we're emotional beings, and we need to learn how to listen to each other, and how we can support men and women in our lives, so that they can also support you. And I guess the third thing, so listen to yourself, listen to the friends and family around you, and then listen to your community. Again, like, we're more powerful when we speak as a community. And the organizations that sponsored this, you guys are amazing for all the social work that you do, and all the raising funds for having products go to the unsheltered. And I'm so inspired by your work. So the more we can listen to what are the needs of the community, what are the needs of your family and friends around you, and what are your needs, the more I think we can ride this wave, so to speak, and become stronger because of it.
Absolutely, absolutely. And I think you mentioned something so important, right? The patriarchy cuts both ways. And so as our emotions are reduced to our hormones, men also don't have the safety to, I mean, one, they can actually lash out, but they also don't have the space to be soft or vulnerable the way that we would be given the space to do so. So this was so wonderful, so engaging. I could talk with all of you for so long and just go on and on. You both are just doing such amazing, wonderful work. And Deidre, I know that you had to step out early, and I am so blessed and honored to have the opportunity. Thank you, Sister Safia. Thank you, Muslim Sisters of Staten Island, for including me and giving me the opportunity to be a moderator for this amazing panel. I know we have a few last closing up announcement, but this is the end of my segment as a moderator. And thank you so much. I will turn this over to Sister Safia for our closing remarks, and then we'll be wrapping. Thank you so much for everyone who's joined us so far, for everyone who participated and commented in the comments, and for your words of encouragement. I know Sister Safia is going to be posting the links, the emails, and all the things that we discussed today. So I will turn it over to Sister Safia. Thank you so much.
Thank you so much, Hina. Can everyone hear me?
Yes.
Okay. Thank you so much. I mean, this was eye opening for me in so many ways, and it brought me back to my first time as well. It's so important for us to support our young women going through these different life changes because it is scary initially, and for those who are unsheltered or those who can't afford products to do some self care, it also can be a little distressing for them. And so that's one of the reasons why also we are doing the campaign to collect feminine hygiene products to be able to, disseminate throughout the community for those who actually are in need of these services because as women we know that how it feels when you don't when you can't get what you need, and now you don't have somewhere to live, and there's so many other additional things that challenges actually that one has to deal with. Having some support when you're going through a natural course in life, especially your period, is I think it means so much to so many women that are going through their changes. There's so many conversations about menopause, which is going to be our next topic of taboo talk when we talk about these things as well, because that's also another thing that women need, that support. I mean, I myself go through those lovely changes. It's no fun. It's no fun at all, but just having the understanding and knowing what's happening with your body, education, like you said, and everyone in the panel has said, it's so important for us to teach our young women and our older women too about life changes and how it may or may not affect you, because everyone does have a different experience going through their cycle and menopause. So I think that's important for us to, have those conversations and help people understand that it is natural. It's a natural course of things, because sometimes I know that some, people will go through depression, anxiety. They don't want to interact with people because, that stigma, and I think one of the things that's important for us to do is to teach our young men how to deal with us when we're going through those changes and understand that, it is a natural thing, and how can they support us in the best way, because I mean, I remember horror stories from going to high school when girls were, having accidents, and guys were just so mean, and because they too did not understand how to cope and how to support people in our the girls in our communities. So I'm really excited, and I'm glad that we had this conversation, and I hope it was of some benefit to all the women who are watching, who will be watching it. We also I know I don't know if everybody is aware of this, but this week has to do with Period Poverty Awareness Week. So this was the perfect time to get this done. And tomorrow is a menstrual health hygiene day. So we're doing the gamut. So if anyone wants to donate to Muslim Sisters of Staten Island, please reach out to us through Muslim Sisters of si@gmail.com. And we're here. If you have any topics that you think that would be of some interest to you and you want to talk about it, reach out to us too. We're open and willing to do another It's Taboo, Let's Talk. So thank you so much, and we'll see you on our next talk. Salam alaikum.
Assalamu alaikum.